Coronavirus is an RNA virus, meaning that it's a tiny virus that belongs to a large family of several viruses. COVID-19 is actually the disease that is caused by one of the subtypes of coronavirus, which is precisely the SARS-CoV-2, which is severe acute respiratory virus, coronavirus 2. The symptoms for COVID-19 are quite a lot, but it is important that for this discussion you can classify the symptoms as symptoms that will allow you to say that the patient has mild manifestation of this disease, severe manifestations of this disease, or critical manifestations of this disease. So there are essentially three symptoms. For patients who have mild symptoms, this is generally the same symptoms you would see with most other viruses like the respiratory syncytial virus, the other coronaviruses, influenza. So you would have patients with sneezing, with cough, with respiratory symptoms like sore throat. Then they would have general symptoms like headache, fever, and body aches. The severe disease would include some or all of the symptoms we have mentioned, which I said were headache, fever, body aches, cough, catarrh, sore throat, some form of respiratory distress. And once it goes into the severe disease, patients will start presenting with some level of difficulty breathing. But these patients who have difficulty breathing would usually be able to persist, exist, and survive even without invasive procedures that require ventilator. The next stage, which is the worst stage, is a critical stage or critical symptomatic presentation of COVID-19. At this stage, the patients are worse off. These patients can die. They would present with all the symptoms that I've mentioned earlier, like for mild and for severe, but they will progress and they will get worse. Principally, most of them would have what we call respiratory failure, an inability to breathe in enough oxygen to keep themselves alive. In addition to the problems with the lungs, they would have problems in other parts of the body. So you have what we call multi-organ dysfunctions. So just as the lungs can fail, the kidneys can fail, the liver can fail, and they can have a situation where the virus is multiplying at excessive level in the blood. So high levels of what we call viremia, meaning virus, emia for blood, virus in the blood. In this stage, patients would have what we call a reaction, which we call cytokine storm. In the process of trying to fight high levels of virus, the body produces excessive amounts of chemicals which are supposed to kill the virus. Unfortunately, these chemicals, because they are produced in excessive amounts, start shutting down different parts of the body. I would open this part of this discussion by saying that there is no proven medication as we speak today, right now, that can either cure or ameliorate the effect of COVID-19. With respect to chloroquine, yes, there was a study from France. This study was published sometime in March this year, but the study had underlying technical letdowns. The study did not meet the criteria for quotable studies. The study itself implicated itself in saying that it could not even be extrapolated. I will give an example, and I probably would want to explain the science behind it. They looked at barely 42 patients. That was one. The second thing was that the intervention they gave, the medications they gave, did not significantly improve or demonstrate that the patients improved clinically. The endpoints of the study were non-specific, were non-clinical outcomes like the presence of the virus in the nose or not. This cannot be extrapolated to practical terms. Then to counteract this outcome, there's another study that came out sometime, still this month, from the Shanghai University, China. That study demonstrated that how the people who took chloroquine and the people who did not take chloroquine, the outcomes were essentially the same. It demonstrated that there was no benefit of either taking chloroquine or hydrochloroquine. It also demonstrated that there may even be a risk in taking this medication. Recently, the special advisor to the executive governor of Lagos State pointed out clearly that some patients had started presenting in hospital with chloroquine adverse drug reaction and toxicity. It has effects in the heart, the eye, and probably in other parts of the body. We will encourage Nigerians to wait until studies come out that are very clear about the role and the use of chloroquine in the treatment of COVID-19. But as of today, chloroquine would cause more damage than good, and we encourage Nigerians to desist from it.